Time now for medical rounds, and not too long ago, people just lived with their back pain. Back surgery was a complex operation that had a very long recovery period, but things have changed. And joining us now is Dr. Heeren Makanji. He is an orthopedic spine surgeon at the Bone and Joint Institute at Hartford Hospital. Doctor, thank you for being with us. And how has treating back pain and performing back surgery really changed?
Thanks for having me. Our whole concept of how we operate on backs has changed from not only the surgical standpoint, but also from how we get patients ready to have surgery, working with our anesthesia colleagues during surgery to make sure that the insult on the body is minimized, and also post-operatively, to make sure that the transition to home for most patients is gentle and easy. From a surgical standpoint, newer technology, newer implants, those types of things have made surgery a lot faster, a lot safer, and the recovery a lot easier.
Which is great news if people have been living with their pain. Tell us about some of the latest technologies.
Sure. I think, one of the biggest things that we're beginning to use more regularly now is robotics in spine surgery. So the current robotic technology allows us to put in hardware more accurately, faster, safer, and also try to minimize the incisions that need to be made to get the hardware into someone's spine. Additionally, most of our implants now are trying to mimic the qualities of bone in terms of how stiff they are and how they heal. And so this has allowed us to use newer implants that behave more like our natural body and allow people to heal better. The bone substitutes that we use are also much better than they used to be. And so our rate of healing, especially for lumbar and cervical fusions, is a lot higher than it used to be.
And I want to make sure you get to your event, but also the benefit of these technologies is the recovery is much faster, easier. Patients are leaving the hospital sooner, so that's great. And you have a webinar so that people can learn more. Tell us about that.
Sure. We're doing a webinar coming up on neck pain. And again, the purpose of this webinar is to educate people on how a spine surgeon goes about figuring out why your neck is hurting, the radiographic and clinical things that we look for, the things that we're looking to ask you about to get a better sense of whether your neck pain is muscular, whether it's coming from the bone, whether it's coming from arthritis, or in some cases, whether it's something more involved, involving the spinal cord or the spinal nerves. And so the webinar is going to be a kind of a summary of, what we know, how we go about determining the cause of neck pain, and then the treatment options that we use, including surgery and the anticipated recovery times.
Thank you, doctor. And that's December 2nd at 5:30. We appreciate you being with us. Also, if you have questions for Dr. Makanji, you can log on to Hartford Healthcare's Facebook page at 1 o'clock today. That's just 40 minutes from now. You'll be able to have an interactive discussion on spine surgery with the good doctor and get your questions answered. And there's a number to call also, 1-855-HHC here.